I'm Dr. Scott Saunders from naturaleDoctor.com, here to talk a little bit about osteoporosis. Osteoporosis is a big topic, and the reason osteoporosis has become a big topic is, number one, people are living longer, so we're seeing more of that problem show up. And then number two, there are several medications out which are supposed to treat osteoporosis, so there's a lot of advertising going on about it. So that's why you hear about osteoporosis. What is it really? Osteoporosis is a weakness in the bones, usually when there's not enough calcium in them. So if there's not enough calcium, then the bones don't have that strength from the calcium, and they can break more easily. Sometimes it's not from a fall. In fact, very often what they found was that the people would say, oh, grandma fell down and broke her hip. But sometimes it's the other way around. Grandma's walking along, her hip breaks, and she falls down. So that's how bad osteoporosis can be sometimes. How do you prevent osteoporosis? Well, the number one thing is to get enough calcium deposited on your bones when you're young. But the other thing is, as we age, we can prevent osteoporosis by continually adding in the calcium to our bones. The medication for osteoporosis that's used is something that kills a cell in the bone that helps the remodeling of the bone. It's actually a poison, and it's permanent. The damage that it does is permanent. The side effect of that is that bones are sometimes built that don't have any strength to them. So yes, they have extra calcium, but because the calcium isn't deposited in the strongest way for the bone, that they're actually brittle because of that. But the other effect can be that the bones don't heal properly. One side effect has been that people who will have their teeth removed sometimes will get necrosis or death of the bone and actually have to have bone grafts put into their jaw because they've been taking these medications. Since the side effects are serious and the benefits are low, I usually don't recommend those medications. One thing you can do that has been shown very conclusively to prevent osteoporosis is to get an adequate supply of vitamin D. Vitamin D3 at the level of about 2,000 units once a day is an adequate amount. One study was done in a nursing home where they gave injections of vitamin D 100,000 units once a month. And there was a dramatic benefit in both how the residents of the home acted and how few fractures they had. Another study was done in a nursing home. The reason these are done in nursing homes is because people in nursing homes don't get any sunlight, so they don't get any vitamin D. So all the vitamin D they have has to be given to them. So it's a great place to do these studies. Number two, they're older, and one of the problems of being in a nursing home is having fractures. So in this particular study, they did different levels of vitamin D. So they had 200 units and 400 units and 800 units, and they didn't see any benefit till they got to about 800 units when they started seeing a benefit. And then the greatest benefit was 2,000 units a day. But what they found was the fractures immediately went down when they started giving 2,000 units a day. It wasn't just because their bones had built up more calcium. Vitamin D actually had a benefit in helping them think more clearly. They had less depression, and they were more clear thinking, and they were more stable on their feet, so they fell less and had fewer fractures. So vitamin D had multiple effects, both for thinking more clearly, decreasing depression, and improving the structure of the bone.